Let's talk a little bit about yeast infections and Candida infections. I think we're probably going to have to go just a little bit faster. I enjoy going a little slower, but there's a couple of more things that we need to cover. Candida. Candida is in all of our intestinal tracts. When we take in antibiotics, when we do something that in a major way interferes with the immune system so that the good bacteria that keeps the Candida under control in the intestinal tract diminishes, then the Candida can morph into a more aggressive form, become toxic, get strong enough to actually worm its way through the intestinal wall and then be spread throughout the body. It is the toxins that cause the symptoms. The causes typically are antibiotic use, but can be birth control pills, corticosteroid use, possibly high doses of sugar long term because sugar just feeds the Candida. Symptoms: bloating, gas, rectal, vaginal itching, fatigue, irritability, depression, chemical sensitivities. You get around perfumes, you go down the soap aisle. Craving for carbohydrates is part of the candidiasis. Candida loves sugar. So it's driving you to eat more. There is, from a history symptom questionnaire standpoint, we can have a high index of suspicion. There is a very good Candida antigen test done by ELISA method. The regular antibody test, I think, is almost useless, and that's the test that most people get. Stool studies for Candida, or how well the stools are functioning, are possible. There are certain organic acids that the Candida produces that then show up in the urine that are also another possible way to diagnosis. Treatment of candidiasis: if there's an obvious cause, stop the obvious cause. Candida diet is really no sugar, no yeast, and the harder thing is no fruit. There's just too much fructose sugar in the fruit that it just feeds the Candida, makes it tough to get it under control. There are some diets that are more aggressive than just those three things. But that, for the most part, I find this is sufficient. Probiotics, which is the good bacteria. Now, there's 15 pounds of bacteria in our large intestine, a little bit in the small intestine, a little bit of that's in the small intestine. 15 pounds of gut bacteria. That's a lot of bacteria that's in the gut. And to think that we're going to take these little tiny capsules that probably aren't even 5 grams, there's 460 grams in a pound, so we're talking 7,000 grams in 15 pounds, and these little 5-gram capsules are going to replace that. It takes billions and billions and billions to start replacing the intestinal bacteria that have been eroded with antibiotic use or with other things. So it takes a lot of probiotics. Some people get scared when they look at 50 billion. No, there's not very much in there. There are some anti-yeast agents, natural herbs. Caprylic acid is actually a fat. It is one of the saturated fats, caprylic acid, very effective against Candida. Garlic, pau d'arco. Caprylic acid and pau d'arco are probably the two most effective things that are easy to get here in the United States. Horopito is an herb that's been used in Australia. We have had reasonably good success with vaginal douching, where you take 1 teaspoon of the probiotic, which now you have billions of the probiotic, and a teaspoon of vitamin C. Vitamin C isn't to kill the Candida, it's to make it a little bit more acidic, because the vaginal area is acidic. If you use an alkaline solution, then it's going to dry that out and make it worse. So we've had good success locally if there's a lot of problems in the vaginal area with the candidiasis. There are some medications that help the gut only, which is nystatin. It does not get absorbed, does not help the body itself, only helps the intestinal tract. Diflucan is a medication, a drug. It's toxic to the liver, but this is the least toxic of all the antifungals. Because there's so much toxin released with Candida, then the liver detoxification, to help the liver with its detoxification work, milk thistle, alpha-lipoic acid. Selenium is a mineral that also supports the liver. If allergies are present, which are not uncommon with candidiasis, then they need to be treated.